is in support of Senate Bill 1, and I want to start out by thanking the chairs and ranking members of the of the Public Health Committee for their leadership on this bill. This is a really important step forward in a number of different respects. And I just want to say that the best outcomes seem to happen when the Public Health and Human Services Committees work together. The Public Health Committee is the policy committee, but the Human Services Committee has a lot of money. And working together, we're able to solve healthcare challenges, and I think we did so in this case. And I just want to say we were able, in the Human Services Committee, to have a hearing on Senate Bill 365, which was really focused on making sure that DSS would be paying for clinic escorts and providing that extra support for safety in workplaces. And I am so thrilled that Senator Anwar and Senator Summers were able to work together, work with us to incorporate so many of those provisions into this legislation. You know, when I first was interested in running for office, I got some training from people who've done it before. And I remember that the first piece of training that I heard was knock on doors, introduce yourself, ask questions, but whatever you do, never, ever, ever go inside someone's home. And that stuck with me. That seemed to be successful advice. You never really know what happens when you go into somebody else's home. And yet, all over Connecticut, every day, 24 hours a day, including in the dead of night, we have home health care workers all across Connecticut who go into people's homes. And they do that because they have to, and they do it alone, without an escort to keep them safe. And in Joyce Grayson's case, that ended tragically. And so what we're doing here with this bill is making sure that we are providing that support so that when you're going into a dangerous situation, you have a clinic escort. And we're also making sure, as Senator Marks mentioned, someone who's a visiting nurse herself, that we're also making sure that all healthcare facilities adhere to basic accredited standards for workplace violence, that we're able to keep our healthcare workers safe as they do their jobs to keep us safe. And that's really important. And I just want to just speak very briefly to one last provision. Last year, Representative Gilchrist and I were approached by a constituent of mine, Regina Stankaitis, asking for our support and doing some important work to build a Parkinson's registry in Connecticut. We informed her that she went to the wrong committee. It was a great idea, but we suggested that she reach out instead to our good friends at the Public Health Committee, and I am just so thrilled to see that they've taken that idea and run with it, and that's now in this bill in Section 26. And so all of those ideas make this a very strong bill. There are other incredibly important provisions in SB 1, and I'm thrilled to support it this evening. Thank you very much.
Thank you. Will you remark further? Good evening, Senator Kelly.
Good evening, Madam President.